Do you or a loved one suffer from sore throat, fever, tiredness, or pain in the limbs? Then you or a loved one may have polio. Let's dig deeper into this diagnosis, shall we? Today, we're going to talk about the symptoms and signs of infections, how it affects the body, diagnostic tools, and vaccinations. Polio is a life-threatening infection and disease caused by the polio virus. There are 3 variations of the disease's symptoms: non-paralytic, paralytic, and post-polio. Non-paralytic polio is what the majority of infected people are diagnosed with when they do not show any symptoms or have mild symptoms. 75% of infected people won't show any visible symptoms, and an additional 20 to 25% of infected people may experience mild flu-like symptoms. Because they are similar to how someone feels with the flu, many people with polio go undiagnosed. A small proportion of people who are infected by poliovirus progressively develop another type of the infection, paralytic poliomyelitis, and have more severe symptoms that affect the brain and spine after initially having the milder symptoms. Some of the more severe symptoms are paresthesia, meningitis, and flaccid paralysis. Don't worry, we'll explain. First, we have paresthesia, which is the feelings of pins and needles in the legs. Meningitis is also very common. In this case, it occurs when the surface covering of the brain and spinal cord is infected with poliovirus. In addition, flaccid paralysis, meaning unable to move parts of the body, can sometimes be seen in patients who suffer from poliovirus infections. Symptoms that are less severe than paralysis, such as weakness in the arms, legs, or both, are often seen too. However, between 2 to 10 people out of 100 who have paralysis die due to the fact that poliovirus affect the mobility of muscles required for breathing. And lastly, we have the third type of the virus, which is called the post-polio syndrome. This typically affects people years after having polio. So, with all that being said, how do we get poliovirus? Beware, poliovirus is very contagious, especially in children under the age of 5. Most of the time, the virus can be found in the saliva and feces of those who are infected. It is primarily spread with person-to-person contact by droplets that enter through our mouth, when people who are infected cough and sneeze near you. If you ever have contact with the feces of the infected person, then there will be a huge chance of you being infected too. So please always wash your hands after using a restroom and avoid people who are sick. Now you might be thinking, what happens if you get the virus? Where does the virus go after it enters your mouth? Once the virus enters the back of the throat, it starts to multiply at the tonsils as well as the lymph nodes at the neck. Then the virus travels to the small intestine, where it invades a structure called the Peyer's patches. If you are curious, check out video 24 on the immune system for more information on Peyer's patches. After the poliovirus is inside your body, it takes 2 to 35 days for the infected individual to develop symptoms. That is quite dangerous if you think about it. You could be asymptomatic for a whole month while you spread the virus to others while feeling completely normal. Over the incubation period, the infected individual tends to show either no symptoms or mild viremic symptoms. Before we move on, let's take a look at what the word viremic means. Viremic or viremia is when there is a virus present in your bloodstream. This is quite serious because your blood travels to almost everywhere in your body, which means if you have viremia, the virus will have access to all the body tissues. But specifically, within 3 to 5 days, the virus can be found in the stool or in the throat at the tonsils. Now let's go back and see how the poliovirus develops in our body. After a while, the virus-containing blood travels to our central nervous system, which includes the brain and the spine. When the virus enters the central nervous system, it causes damage due to its ability to change the structures of the cells in our body. As a result, paralysis could happen, meaning that the patients will not be able to move certain parts of their body, such as their arms and legs.
So, how would a doctor or other medical professional find out if you've been infected? Well, there are 4 different tests. The most sensitive test is an analysis of the patient's stool, and it often leads to the most valid results, because the virus only takes 3 to 5 days to show up there. Another test is the patient's blood to see if there are any antibodies present. Fun fact, antibodies are small molecules that flow in the bloodstream fighting against infectious diseases. Other samples can be taken from the back of the throat or even in the patient's cerebrospinal fluid. The cerebrospinal fluid is liquid that helps cushion, shield, and support the brain and spinal cord from damage. These samples are taken and watched over a few days to see if the disease will spread and populate the area. We've included a chart on all of the diagnostic tools differences, but you don't need to memorize them just yet. Actually, it's time to talk about treatment and getting vaccinated. So unfortunately, there is no treatment for polio because mild symptoms typically resolve on their own within a few days, or the more severe symptoms lead to permanent damage within hours. But there is focus on vaccinations, and there are 2 types of vaccines: oral polio vaccine, OPV, and inactivated polio vaccine, IPV. The first one, OPV, is a live attenuated vaccine, so it has the virus DNA in it. It sounds scary, but actually the specific parts of the DNA that allowed the virus to spread are removed to avoid causing infection. The second one, the inactivated vaccine, has the whole body of the virus with all of its DNA removed. The development of polio vaccines has become one of the largest and most expensive U.S. public health experiments, known as the Salk trials. One company, Cutter Laboratories in California, accidentally released live, contagious polio virus and caused 40,000 new cases of polio, permanently paralyzing at least 200 children within days and killing 10. Realizing this huge error and fixing the vaccine to make it actually successful, the World Health Assembly launched a global polio eradication initiative in 1988 to completely get rid of polio worldwide. Wild poliovirus cases have gone down by 99% since this program was enacted. Of the 3 strains of wild poliovirus, type 1, type 2, and type 3, type 1 only affects Pakistan and Afghanistan as of 2020. Type 2 was eradicated in 1999, and no cases of type 3 have been reported since 2012, where it was last seen in Nigeria but is now considered eradicated as well. Phew! So folks, that is it for today's talk on the poliovirus. If you feel that you have any of the symptoms we discussed earlier, please visit your physician immediately.